It's Wellness Wednesday on the Rickey Smiley Morning Show.
All right, y'all, Rickey Smiley Morning Show. It is Wellness Wednesday, and shout out to everybody in the Cincinnati area, y'all. We're going to be on the square broadcasting live in the morning. I'm so excited about that. Now, listen, every Wednesday on the Rickey Smiley Morning Show, it's Wellness Wednesday. We have the one and only Dr. MJ Collier is back to help you stay healthy. Dr. Collier, good morning. Happy to have you.
Good morning, Rickey Smiley, Rock T, Special K, Gary with the T, Alfredus, and the Brett. Thank you, Rickey, for the opportunity to bring healthcare information to the listeners of the Rickey Smiley Morning Show. So, Rickey, this is Chronic Disease Awareness Month. One disease state that you hear about all the time is gluten intolerance, gluten sensitivity, and even celiac disease. So, Brett, Alfredus, Rock T, Gary, TJ, have you ever felt bloated, tired, or had stomach pain after eating bread, pasta, or other foods containing wheat? While many people blame gluten, it's important to understand that gluten intolerance and celiac disease are not the same thing. Gluten intolerance can cause symptoms such as bloating, abdominal pain, headaches, fatigue, brain fog, all kinds of symptoms. These symptoms can be uncomfortable, but gluten intolerance does not damage the small intestines. Celiac disease, however, is an autoimmune disease, Rickey. In people with celiac disease, eating gluten triggers the immune system to attack the lining of the small intestines. That's why they get bloody diarrhea and other symptoms. Over time, this can cause problems as the lining of the intestines tries to heal itself. It scars over, and wherever it's scarred over, it cannot absorb important vitamins and nutrients. This leads to weight loss, osteoporosis, anemia, and delayed or impaired growth in children. So it can make your children small, tiny, make them just appear weak and tired. Effective treatments, of course, include lifelong gluten-free dieting. This means avoiding foods made with wheat, barley, and rye. Fortunately, safe alternatives include rice, corn, quinoa, the ultimate, and potatoes. Other natural supplements to improve GI health includes probiotics, omega-3 fish oils, and vitamin D3. So I have all my patients, any patient, young, old, black, white, male, female, if they're complaining of any GI problems, then Dr. Collier highly recommends that you get probiotics. Probiotics are God's gift to GI health. So if you experience ongoing digestive problems, unexplained fatigue, have a family history, and everybody at the family reunion talks about, the Colliers, we're allergic to milk, we lactose intolerant and all of those sorts of things. And so that's not necessarily the case. Oftentimes is that you're allergic to glutens. So before you start a gluten-free diet, however, there are blood tests that can confirm this disease state, or even if you have bad symptoms, intestinal biopsies that can confirm the diagnosis. So eating well starts with knowing your body. If you have concerns about your GI health, persistent symptoms should not be ignored. So no matter if you're male, female, young, or more seasoned, your GI health will be improved by taking Dr. Collier's recommended trio for good health: omega-3 fish oil, probiotics, and vitamin D at 5,000 international units every day. I do it myself, and I know it improves my GI health. So stay healthy, stay informed.
Oh, I appreciate that, Dr. Collier. Let's go to the phones. You're on the phone with Dr. Collier. Good morning.
Yes, I just recently had my gallbladder removed like a month ago, and I was just wondering, should I be taking some kind of medication? My doctor is saying I don't need to, but I'm seeing TikTok and everybody's talking about it. So any suggestions?
Definitely, one, you need to stay on a low-fat diet, because what the gallbladder does, it holds and stores bile. Bile is the component that's necessary to break down fatty foods, and when you don't break those fatty foods down, they present with what's called a colloidal effect and can give you explosive diarrhea. So you eat a pizza, you eat explosive diarrhea, uncontrollable. And so you quickly learn what foods will do that. They call that the dumping syndrome. So you need to stay on a low-fat diet. But, of course, probiotics will help optimize your GI health and to keep your gut healthy. So I would definitely recommend, as a supplement, probiotics, and then, of course, avoiding fatty foods. You will learn over time, again, what foods you need to stay away from. And when you eat a variety of foods, like, say, you go to the buffet, like Golden Corral or someplace like that, where there are multiple foods, your stomach can't tolerate that. And so you'll find that you can't get out of the building before you have to go to the toilet. So be careful and conscientious about the variety of foods that you eat. Your preferred method of food preparation is baked or broiled, not fried. And optimize your health now with that gallbladder out now.
Yeah, man, I had ate about 4 of them little soft tacos at Taco Bell and looked in the toilet, and I had made a chalupa.
Mr. Smiley.
Dang.
Same ingredients, tomatoes, lettuce, and meat.
Man,
They just changed the name to protect the
innocent.
innocent.
Get a epidural. What the hell? All right.
A chalupa.
All right, you're on the phone with Dr. Collier. Good morning.
I started taking glucosamine for stiffness in my joints, but it seems like since I've been taking it, my knees have gotten worse.
Okay, glucosamine is a great supplement. It is the only thing that literally will repair the joints. So what you have is a progressive arthritis, which is inflammation of the joints. So other anti-inflammatories will help tremendously. Again, omega-3 fish oil is very good because it's a natural anti-inflammatory and it helps kind of oil the joints. But you might need a prescription anti-inflammatory. The first level, I would say, would be something like Celebrex or Meloxicam Mobic. Then there's naproxen, ibuprofen. Ibuprofen at 800 is God's gift to the joint pain, but you can't keep taking that without it causing some stomach problems. So you need to be on a combination of therapies. Maybe you can try over-the-counter anti-inflammatories like Motrin, Advil, Aleve. Double the dose that makes you prescription strength, but always take those with food so you don't irritate your stomach, and then see if that gives you some relief. Also, Tylenol Arthritis Strength is very good for pain. It is not, however, an anti-inflammatory. So you can add it to that treatment regimen or take it and see how that works as well.
All right. Hey, listen, y'all get us 866-9-RICKEY, 866-9-RICKEY. More of your phone calls with Dr. MJ Collier coming up. Rickey Smiley Morning Show. Listen, if you want to talk to Dr. MJ Collier, hit us up at 866-9-RICKEY. We got him on the phone right now. I'm sorry, Dr. Collier, we have somebody on the phone. Good morning.
Yes, I've been on the GLP-1s, and it hasn't been working for me. I work out. I've taken Wegovy. I'm on Zepbound. I've done Weight Watchers. I've done all the things, and it still doesn't seem to be working for me. What more can I do?
Okay, that's a great question because we are now understanding that there are people that genetically are resistant to these therapies. They do work, however, you just have to find which one of the products gives you the best benefit as well as the appropriate dosing. Oftentimes, when you are resistant to it, when you start on the lower doses, you don't see any real benefit. But as you titrate up, which is what you're supposed to do on these medications, you go to the maximum tolerated dose, then it's just almost impossible not to lose weight. So going to the gym and everything gets you healthy. I tell people, but you don't lose weight in the gym. You lose weight in the kitchen. So what's important is that you're burning more calories than you are taking in. That is the universal way to lose weight, no matter what methodology you're using. So we want to make sure that you are monitoring your input so that you can get the weight loss journey that you are seeking. But the GLP-1s literally are the greatest breakthrough in the history of medicine that I'm aware of since I've been practicing. You can go to my website, lipodrops.com. We have a direct link for online GLP-1 therapy now. So you can get semaglutide, tirzepatide, and other GLP-1 type products along with counseling and the information that you need to optimize your weight loss journey.
All right, you're on with Dr. Collier. Good morning.
Yes, good morning. I was wondering, in black women, I have ingrown chin hair. What would he suggest? And is there anything out there that I can go to the store and get to help with that? And what can I use to remove it without the ingrown bumps and everything?
Yeah, that's a problem that oftentimes when you have curly hair, it can turn in and grow in. So this requires a continuous treatment regimen. One, I tell patients, take a soft toothbrush and brush the skin so that you're opening up those pores, and just brush it gently. Don't grind it and abrade it. Just use a soft toothbrush with an antibacterial soap like Dial or Lever 2000. Then use a 5-blade razor to shave. And black men and women shave down. Do not turn that razor upside down and go up your chin. One stroke down on one side, rinse. One stroke down and rinse, and use a shaving gel, not a shaving cream. Now, other options would be also depilatory creams that remove the hair without you having to shave it all or getting it waxed, but you got to calm down the inflammation in that skin. So 1% hydrocortisone cream, which you can get at the store where everything's $1.25. 1% hydrocortisone cream. So this treatment regimen is going to require you to do all of these things continuously. When you do them, your face will clear up and no problems. But once you stop, it will regress quickly. So you're going to that's the way you're going to have to take care of this. But as a woman, you probably won't have to do it daily like men would have to do. Probably 2 to 3 times per week would do that. I have full instructions on appropriate shave technique for African Americans on my YouTube channel. Go to Ask, ASKDRMJ on YouTube. Look for the video on shaving. It explains all of this very well. It gives you the entire treatment regimen.
All right, y'all, Dr. Collier, good morning.
Good morning. I am a black woman living in Ohio, and I have been getting iron infusions because my HB is running around 10. Is there anything else I could do to help that condition? I don't want to do any more of the iron infusions. I just want to know, is there anything else I can do? I also take 81 milligrams of iron every day.
Okay, that's a lower dose of iron, but higher doses can be constipating. So I would recommend one that you take probiotics and or eat a cup of Greek style or Activia brand yogurt on a daily basis to prevent the constipation. 2, you don't have to keep getting the iron infusions. Once your levels are up, hopefully your body will manufacture, your bone marrow will manufacture enough blood to keep your blood count up. But secondarily, make sure that a complete evaluation has been done to figure out why you're bleeding and losing blood. And it starts off with a colonoscopy and possibly an upper GI or an endoscopy, and even where you swallow the capsule camera that goes all the way through your GI tract. And then are you having any bleeding from your female organs? All of these things, you need to find the etiology of why you're losing blood. But if there's no obvious reason and you're just not making enough, then the supplemental iron would be good. I would recommend one, the iron tablet that you're taking, but also a complete multiple vitamin, like one a day for women, Centrum or Z-Bec with iron. The Centrum Senior does not have iron in it, so you have to make sure a complete multiple vitamin with iron and minerals, along with the iron supplement that you're already taking, and optimize your iron levels so that you don't have fatigue and all the things that go with anemia, weight gain, bloating, all of those things.
All right, Dr. Collier, appreciate that and appreciate everything you do. Let everybody know how you can be reached.
Okay, Rickey, tonight, YouTube Live broadcast, Facebook Live, and Instagram Live. Ask Dr. MJ. Why? Because your health is important. The only interactive forum that allows you, the listeners, to call in and ask your healthcare questions. This is a broadcast, not a podcast. You are literally talking to Dr. Collier in real time. So tune in tonight, 6:30 p.m. Eastern Standard Time on my YouTube channel. Ask DRMJ, Ask Dr. MJ. Go to and subscribe to that YouTube channel where we have hundreds of videos on various healthcare topics. Don't believe me, just watch. And go to the official website, lipodrops.com, where you'll find information on Dr. Collier's Optimal Life Trio with omega-3 fish oil, probiotics, and vitamin D3 supplementation. On the Lipodrops website, click on Weight Loss Solutions for a direct link for online GLP-1 therapy, semaglutide, and tirzepatide. Once again, follow me at Ask Dr. MJ on all social media platforms. Next week, Rickey, I'll be broadcasting live from the National Medical Association Conference in Puerto Rico, where I'll be speaking on 2 topics. I'm speaking on limb salvage and sickle cell disease. And remember, these are the opinions of Dr. MJ Collier, not those of Rickey Smiley, the Rickey Smiley Morning Show cast, or its production crew. Stick and stay. Don't you dare go away. You're listening to Dr. MJ on the Rickey Smiley Morning Show.